Hi guys, so today's video is going to focus on psychological therapies of schizophrenia. Cognitive behavioral therapy is the major therapy to treat schizophrenia. Um, the basic assumption behind this therapy is that the schizophrenics often have a distorted, delusional and irrational beliefs which influence and produce schizophrenic symptoms and behavior. For example, someone with schizophrenia may believe that something is controlling their beliefs. Schizophrenic delusions are thought to be a result of faulty interpretation of events, and CBT is used to help patients identify and correct these. It is assumed that once these are identified, patient symptoms will reduce. There are two major CBT approaches. Firstly, stress management. Stress is believed to trigger off schizophrenic symptoms, known as the diathesis stress model. By stress reduction, the patient gains an understanding of their individual triggers, and together with the therapist can develop strategies to cope and combat schizophrenia more effectively. Potential cognitive strategies include distraction from intrusive thoughts or challenging their meaning. The second the second approach within CBT is belief modification therapy. This aims to challenge a person's thinking, questioning the validity of their irrational thoughts. It is assumed that this will allow the patient to see that the delusions they are experiencing are false and merely a symptom of the disorder. AO2, there is lots of research to support the use of CBT when treating schizophrenia. Outcome studies of CBT suggest that patients who receive CBT experience fewer hallucinations and delusions, recovered from their functioning to a greater extent than those who received medication alone. This gives us direct support to the idea that the disorder must have some psychological stemming and not solely biological. Illustrates how most therapies are more effective in combination. So that's a more holistic approach being taken. Furthermore, Jury et al. Found that benefits in terms of a reduction of positive symptoms and a 25 to 50% reduction in recovery time given a combination when patients were given a combination of antipsychotic medication and CBT. Such findings stress the effectiveness of CBT. Although, as most effective studies into CBT have been conducted in combination with antipsychotics, it limits the validity of the treatment. We are unsure whether the antipsychotic or CBT had more of an impact and makes it difficult to assess the effectiveness. Long-term effectiveness. A further strength, however, is unlike antipsychotic medication, CBT is deemed more suitable, long-lasting treatment. This is because when effective, it allows the patient to address the actual cause of their symptoms rather than simply reducing the symptoms, which drugs do. CBT also has much lower risks of dangerous side effects, as antipsychotics are famous or known for this neurological disorder called tardive dyskinesia, which results in involuntary jerky movements of the face, making CBT a more ethical treatment. However, it is not suited to all. However, there is an issue of usefulness. CBT, how useful it is for all patients. This was shown by Kingdon, who found in a study of 142 schizophrenic patients, most patients were not deemed suitable for CBT, as it was believed that they would not engage. Older age participants seem less likely to be suited to CBT than younger patients, so it implies this treatment cannot be used by all schizophrenics. This may be because, as the disorder is degenerative, and the longer it is gone untreated, it is harder to combat the falsehood of delusions, which I actually said here. Also, in chronic patients where schizophrenia is long-lasting, CBT does not reduce the likelihood of relapse, despite the fact it produces improvements in mental state and positive symptoms. So again, can only be used for acute causes of schizophrenia. This is perhaps because the longer schizophrenia has gone untreated, combating the falsehood of delusions is a lot harder, as I said before, and may in turn encourage episodes of extreme paranoia as they question the motives of the therapist, which would not be good. Family intervention therapy is another psychological therapy which aims to tackle the type of communication within a family. It is believed that levels of high expressed emotion within a family causes or influences schizophrenia. Therefore, educating family members about the disorder, ways to improve communication styles may in turn help the betterment of recovering from schizophrenia. Pharaoh support for FIT, family intervention therapy, who conducted a meta-analysis and found that FIT was effective in reducing relapse rates, suggesting the usefulness and treatment. Although it should be stressed, it is more likely to be used in combination with other treatments, such as antipsychotics, for it to be effective. However, the analysis revealed family intervention therapy to have a wide range of outcomes, so results are not conclusive. As the therapy varies in outcome, it is not a reliable way of treating schizophrenia as individuals react differently. However, the therapy is used in current practice and shows that it is clearly most suited to patients living or near a family and could be extremely beneficial for certain schizophrenics. As there's a wide range, you could also argue that perhaps not all causes of schizophrenia are psychological and more biological, therefore weakening psychological therapies of schizophrenia. But that is all for this video. Thank you so much for watching.